The PARALLAX study is a fairly large trial of 2,566 patients with heart failure with preserved ejection fraction that were randomized to receive Sacubitril, Valsartan, or a mix. It was called an individual medical therapy. And as you know, in heart failure with preserved ejection fraction, there's controversy about the optimal treatment. And many patients with this disease still receive RAAS blockers, although we don't have solid evidence for that. So in this trial, there was a focus on surrogate endpoints, NT-proBNP levels at 12 weeks, and 6-minute walking distance at 24 weeks. And this was mixed with some other endpoints for quality of life, but also some hard endpoints, exploratory endpoints, cardiovascular death, and heart failure hospitalizations. And the overall study results showed that Sacubitril Valsartan was effective in lowering NT-proBNP levels at 12 weeks. It was neutral with regards to the quality of life outcomes, but there was also a strong signal for less heart failure hospitalizations and a lower rate of cardiovascular death. And I think the latter two is also important because it extends findings from the recently published PARAGON study, which was larger, an outcome trial. And as you probably are aware, that nearly missed the hard endpoint with a p-value of 0.06. But I think together with this trial data, there's accumulating evidence that if you think about RAAS blockade in heart failure with preserved ejection fraction, then likely Sacubitril Valsartan is the most effective drug, more effective than the ARB or the ACE inhibitor. And I think that's the takeaway message. And it's very useful data for the guidelines that will come out in 2022-21. And now we have PARAGON, PARALLAX, and we had the small trial Paramount. So there's enough data to look at, and this is a very useful addendum.